So one of the dogmas that exist nowadays is that after a diagnosis and a treatment for breast cancer, a woman cannot get pregnant. What we know at this time, and based on all the data that is available, is that that dogma has no reason to exist. So it is clear from all the data that exists that getting pregnant after a diagnosis of breast cancer does not increase the risk of relapse. And therefore, there is no reason to contraindicate or to tell to a woman that she cannot get pregnant after a breast cancer diagnosis. For the specific group of luminal breast cancer, so breast cancer that depends on hormones, endocrine responsive, the patient after the acute period of treatment with surgery, chemotherapy if necessary, radiation therapy if necessary, will start the endocrine therapy, which are pills that are taken every day for a period of 5 to 10 years. So for this specific group of patients, it is not that the pregnancy will induce a higher risk of relapse, but the pregnancy will demand an interruption of the endocrine therapy, interruption of the treatment, because these pills, these agents, can induce malformations in the baby. And so the treatment must be interrupted to allow for the pregnancy. Now, from the data that we have, we believe that this also is not prejudicial to the mother, to the patient. And there is a clinical trial ongoing that it's called POSITIVE. What the trial does is that we are trying to mimic what we now recommend that we do in the clinical practice. So if a lady is on endocrine therapy and she and the partner decides that wants to get pregnant, what we do is interrupt the treatment, allow for what we call a washout period, so a period of about 3 to 4 months when nothing is taken, but that the lady also does not try to get pregnant, to eliminate all the drug from the organism. And then from that moment on, she can start trying to get pregnant. And after the period of gestation, have to deliver, and after the delivery, it's even possible to breastfeed. Another dogma is that patients who had a breast cancer can no longer breastfeed. That is not true. You cannot breastfeed from the breast that was treated. It is true, particularly if you receive radiation therapy, because radiation destroys the ductal cells where the milk is produced, but you can breastfeed with the other breast. And so it is totally possible. So the study allows for a period long enough to allow the period of trying to get pregnant, the pregnancy, the delivery, and eventually some months of breastfeeding. If the time to get pregnant starts being too long, it is a difficult situation and a difficult discussion that the patient and the oncologist must undertake. Obviously, we would like to stop or interrupt the treatment as shorter as possible. And so there has to be a balance between the time that we interrupt the treatment and the time needed to get pregnant. If for any reason the time to get pregnant is too long, we may reconsider to resume the treatment and then try again later, or we may consider some appointment on a fertility expert, which is something that in principle everyone should try if after a few months she does not get pregnant. Also, you may balance that with the period of breastfeeding. If someone gets pregnant very quickly, then you may have more time for breastfeeding. If you have taken a long time to get pregnant, maybe it's better not to extend the interruption period by breastfeeding and avoiding that part. So it's always a balance and something that has to be decided on a case by case. So after this period and of pregnancy, delivery, and eventually breastfeeding, patients will resume the treatment that they were taking for a total time of 5 to 10 years according to what had been previously decided. So what we advise to any young woman who still has desire of becoming a mother is that you contact a specialized center and you discuss your case with a specialist and someone who has experience with this particular subject, so that we can decide and help you decide if it is the appropriate timing to stop the treatment and try to get pregnant. For those who have other subtypes of breast cancer that do not depend on endocrine therapy, then the situation is easier since there is no treatment ongoing, and all you need to know is that there is no contraindication to become pregnant. Having said all this, obviously there is a period of time that we usually ask the patient to wait, and it's usually between 2-3 years after the diagnosis. There's nothing magical about the 2-3 years, but we know that it's the time where the risk of relapse is higher. When someone wants to be a mother, obviously she wants to be there for the child. So if we go through the period of higher risk of relapse and nothing happens, then the probability that everything will be fine is much higher than within those first 2-3 years. So this is usually what we recommend. For the positive trial, we recommend that about 18 months, so 1.5 years of the endocrine therapy is taken. So that gives about 2 years after the initial diagnosis. And then the patient is free to try to get pregnant.